My name is Marco Pino. My co-author, Victoria Land, and I just published a paper titled How Companions Speak on Patients' Behalf Without Undermining Their Autonomy. In this study, we analyzed a number of recorded consultations involving patients with a life-limiting condition, sometimes referred to as a terminal illness. Their companions, who were accompanying family members or friends, and health care practitioners who specialized in palliative care. These were doctors, physiotherapists, and occupational therapists. These consultations took place in a hospice in the UK. In this project, we were interested in how these participants initiated conversations focusing on the patient's prognosis and end-of-life care. We noticed that in many cases, these conversations started from an allusion that the patient usually made to their own thoughts or feelings about the prospect of future deterioration and dying. But we also noticed that in a number of cases, it was the companion who made an allusion to the patient's thoughts or feelings about dying. This struck us as quite peculiar. Why would someone share something quite personal on behalf of another person? This happened in a number of situations. For example, a doctor asked a patient a question and the companion answered on the patient's behalf. We studied the literature, and a number of researchers had also studied recordings of consultations in different healthcare settings and had come across this particular phenomenon of a companion answering a question addressed to the patient, and in the process of doing so, sharing something quite personal on the patient's behalf. And these researchers were talking about these companion actions as undermining the patient's autonomy. Now, our findings have been very different. We used an approach called conversation analysis, in which we examine participants' interactions, the language they use, but also the embodied visible behaviors they use, such as gaze or gestures, in a lot of detail. And we noticed that these companions intervened on behalf of patients only in very specific circumstances. There was always something that justified the companion's intervention. For example, a doctor addressed a question to a patient. The patient displayed some difficulty in the moment answering that question, and only at that point the companion came in answering the question on the patient's behalf. They also did it in a tentative way that gave space for the patient to subsequently have the final say on that particular matter that pertained to the patient's own experience. So across all these cases we analyzed, we found that the companions were intervening on behalf of the patients, but were not doing so in a way that was undermining those patients' autonomy. Their contributions were justified exceptions to a prevailing norm that these companions clearly were respecting, a norm whereby patients are entitled to speak on their own behalf. So with these circumscribed momentary interventions, the companions were actually supporting the patient's autonomy within those healthcare consultations. So these were our findings. This study has some important implications for the sociology of health and illness, because it shows how companions sometimes contribute to the organization of healthcare interactions, particularly in the particular ways in which they support patients' autonomy. The study also has some practical implications, for example, in terms of ways in which healthcare practitioners can support companions' interventions within healthcare interactions.